Eva's Village, located in downtown Paterson, New Jersey, has been providing critical services to our impoverished neighbors struggling with hunger, homelessness, substance use disorders, and mental health challenges for over 40 years. Through our integrated social services and behavioral health programs, we empower these individuals to lead healthy, independent, stable lives. We believe everyone deserves access to the programs and treatments that they need to address their individual challenges. And accessibility begins by removing barriers. For example, our community kitchen is open to anyone who wants to come in for a healthy, nutritious meal, any adult. We also welcome children as long as they're with a parent or a guardian. Our goal is to make it as accessible as possible, so we don't ask you to check in, we don't ask for a name, we don't ask for ID. We want people to feel that they can come in here without judgment and get the services that they need. Our emergency shelters are also low barrier, and we do that intentionally with the idea of getting as many people off the street as possible. You don't even have to be sober to come into our shelter, and we will provide the services that you need. In addition, our substance use disorder programs are also very accessible. You don't have to have any money, you don't have to have any private insurance, and if you don't have Medicaid, we'll help you get enrolled so that you can get the services and the treatment that you need. Paterson is a diverse city. It's a vibrant city, but it also has a lot of challenges. We've got rampant drug use, there's homelessness, there's food insecurity, there's substance use disorders. So there's a lot of challenges that our population is facing. Our neighbors need access to care. They need access to treatment. They need access to hope. And that's where we at Eva's Village deliver. By remaining a low barrier option, we can help those who are left behind. One example of our accessibility is through our community kitchen. Mark and Catherine, a husband and wife, are regulars at the community kitchen, and they come for lunch. Recently, Mark had surgery on his foot and was unable to walk or stand. So he was unable to stand online and enter our community kitchen. Our community kitchen staff worked with them, and they decided, let's give them to-go meals. This is just one example of how we are making our services accessible. In New Jersey, we are now allowed to provide mental health services right in our emergency shelters. So now this particular population is going to have access to this much needed service. In addition, MAT, medically assisted treatment for opioid addiction, is also now available through our shelter system. We know that the population that comes through our shelters often deals with mental health issues and substance use disorders. So by offering MAT to this population, we can help them on their path to recovery. It's a way for them to get access to treatment that they never had access to before. We believe accessibility shouldn't just be a goal. We believe it's a fundamental right for individuals who need help. By embracing accessibility, we not only lift up individuals, but we're also building a more inclusive community. Together, we can break down barriers, spark change, and create a future with equal access to services for all.